welcome to Beyond the Mirror podcast. Today I'm pleased to welcome my guest, who is one of the pioneers in medical aesthetic fields and very well known person and professional in the industry. Nurse and owner of the clinic Pro Aesthetic, Rosie. Welcome, Rosie.
Thank you. It's lovely to see you.
Thank you very much for coming.
Pleasure.
It's a pleasure to have you, and I'm very excited to hear about your journey. So can you please tell us, how did you start in aesthetics?
Well, there's always a story with me. So I was a nurse. I had been a registered midwife and health visitor, so career in the NHS, long-standing. And I guess I got to that junction in life where you'd had, for me, 2 children. And on my second maternity leave, working part-time in the NHS as a health visitor, I decided to do a beauty course. So this was basic beauty treatments, and got a diploma. And that led me to, when I joined the local gym, to be introduced to a doctor who has been in aesthetics longer than myself, quite well known. And I was talking to her and just wanted to look at aesthetics. You know, I was intrigued by it because this was when, you know, sort of injectable treatments were just starting, but they were such a small part of where we are now. And I asked to go along and see her practice, and she was doing a couple of days a week. And I thought it would be like, you know, Eddie and Davina off Ab Fab. You know, it would be all flamboyant and darling this, and it was a bit of that. But I went along and I saw some treatments and I thought, this is amazing, amazing. And I didn't realise that nurses could actually train in aesthetics at that time because it was so new. But actually, nurses could train. And I then embarked and started on my first training course, which was at the laser clinic, I think, on the park in Nottingham. And I did my first course there, and that sort of started my career from there and never looked back. It was like fate.
How long ago it was?
It was 22 years ago.
Wow.
22 years ago when I went on that first course, probably around May. So this year will be a little bit of an anniversary of that. So, but it was a very basic course that we did. I think in that time, you know, what we call neuromodulators, or for soft lines, that we can't mention the drug. That was the most popular treatment, and it still is. It still is today, which is fascinating. But it was the whole day spent on those techniques and, you know, assessing the theory, anatomy, physiology, you know. And then I believe I went down to London for the dermal filler training. But there were some parts of me being a midwife that wasn't so comfortable going into it. It was very nerve-wracking.
Of course.
You know, injecting somebody's face, and I wouldn't answer my phone for 3 or 4 days after I treated, you know, friends and family. After I'd done that course, it was really nerve-wracking.
Wow.
So, you know, the clear route for me from there was thinking, right, okay, I either give this up or I go for it. And the only way for me, with my midwife background, was to actually join one of the major UK providers in surgery and non-surgical treatments. So I joined the corporate side, and that threw me and immersed me into aesthetics.
Well, I suppose you did it in a way where you also have had a team who were able to support, so you felt a part of a group rather just being there on your own.
Yes.
But now you have a thriving clinic, good business. So when did you start that?
It seemed to come organically. So I worked for, it was Transform and the hospital group that I worked for part-time alongside the NHS. And I think when you get to a certain point where, you know, it was a rapid ascension into, you know, into aesthetics for me, because I'd thrown myself into it. So I was straight away doing 6 or 7 treatments a day, which is very different if you work totally independently. It's a slower start. So I think as I became more proficient I would never say I'm confident, but more comfortable with aesthetics. And that team around me, I started to treat people from home. Okay. So I started to naturally build up through links, through friends mostly. Naturally started to draw traction at home. I had a converted treatment room at home. And that started to again encroach onto my full week. So I was 2.5 days in the NHS, I was 2 days aesthetics. So full time, but in 2 different areas. And it became very clear that there was a decision to be made between the NHS and if I wanted to pursue aesthetics further and develop further, there had to be a choice and something had to change.
So, and you chose aesthetic.
I chose aesthetics. It was a hard decision because, as you know, you have an NHS background and you have a vast support and network around you that you're familiar with from your early professional days when you trained, and that is a safety blanket. It's comfort. You're not overstretched clinically. So it feels very comfortable, it feels very safe, you're supported, education's there for you, but with changes within the NHS. And when I look back at my CV, I have moved after about 4 or 5 years, I get bored. So if you look at my nursing experience before I went into midwifery, and from midwifery into health visiting, and then health visiting was the longest I stayed in one place. And that was about 16 years, but I had my family in that time. So that was a big life change. So work stayed the same. But I have never, ever worked in an area like aesthetics that is always progressing. It's always challenging you. And I never thought that it would. Yeah. But for me and my personality, and for you, knowing you, it works very well because that's what fires us.
Oh,
that's
absolutely.
The beauty of it.
Absolutely. The things change, and sometimes I feel that aesthetic leads improvement in medical field, like we're looking at prevention, early intervention, and I think it's overall impact on when we having the time for self-care, because aesthetics, it's a definition of so many things. I think mistakenly many people think that aesthetics is limited to injectables, but I think it's far beyond that.
Yes, it is. It is. And I think at that time, medical and aesthetics were quite, they were going in different directions.
Yes.
The medical world didn't particularly view the aesthetic speciality as something that was respected, or it was sort of like sidelined, whereas now there's much more merging, as you say, of medicine and aesthetics.
Absolutely. And last year I believe they established a faculty of aesthetic medicine at Royal Society of Medicine, which is I think a great achievement to celebrate. So that's excellent. And Rosie, how was your family when they knew that you changing your career from NHS to go into private sector, but not only private but medical aesthetics? Was it supportive, doubtful, negative?
Generally, they were really good. They were really good. I think my mother this was at a point where my father was no longer with us. He'd passed away. My mother is an NHS background, so she was a nurse and a health visitor. So for me to make the decision to leave the NHS, that scared my mother, because she'd always been within the NHS. Although she supported me, I don't think she was totally agreeable of me leaving the NHS, purely because at this time I'd gone through a divorce as well. When I bought my first business, I went through a divorce within 2 months. And so I was virtually a single parent when I was trying to build the business. And I think all of the emotional side of that impacted my decision to leave the NHS. And I had to work very, very hard to make that transition and to make it work. So although she was supportive, I don't think she could quite understand business. My friends were amazing, absolutely amazing. They just thought oh, she's off again. So, another challenge because I can't stand still. So they were great. And as I say, my husband at the time left. So it was very much sort of my friends and my mum that were supportive of me. So, yeah.
Well, you're a very strong woman, building it all yourself. And I think as a woman, sometimes we can do so much at one time. And having a young family and building a business is incredibly hard.
Yeah.
I know I've been there, but I have had support of my husband. And I know it's still not easy.
Yes.
Even if you do have support. On the other hand, I didn't have support of my family because they're in different country. I have the mental support, but not physical support.
Yes.
So that is admirable. I think you should be very proud of what you achieved.
Thank you. Achieved. Sometimes you just keep moving, don't you? And I think it's a lesson in life where really we should look back.
Yeah.
And we should. It sounds a bit corny, but celebrate what we've done. But we don't often do it.
No,
I think we tell other people to.
You think what's next?
Yes, we do. we sort of think, right, okay, you've achieved that. Go again.
Rosie, and did you have a mentor in your career, or maybe few mentors who played a role and shaped your career as an aesthetic nurse?
No, not at all. And that's an exciting development of modern day aesthetics now. That sort of facility or that support wasn't available. It just was not there. And treatment-wise, the treatments were very limited. The products were very limited. We didn't have devices. There were cars on the road. There were cars. It sounds like so old. So no, there were mentorship had not been heard of. I think it was only just coming into the NHS 20 years ago. So it was really choosing those people that could be around you, choosing well, and really sort of learning from each other. But as mentorship, there was nothing at all.
Making a reflection, what is available now, do you think mentorship is a good option for practitioners who are starting their career?
I think it's vital. I think many medical professionals enter aesthetics. And maybe it's the same when we go into other specialities within NHS or private work, but within aesthetics, the challenges are immense. And it's hard, I think, the conversation with leading medical practitioners within aesthetics before you enter into aesthetics is essential. So, actually observing within a clinic, seeing what a day is like, seeing what the treatments are like, what the challenges are, having those conversations. There's a lot of forums online, and I know that you've done some of this work as well. Gives a much clearer insight into what you're going into. And it's jubilant, it's amazing, there is nothing like it. But having that information that's out there now to sort of, say exactly the best way to go about it, pitfalls to avoid, people to link up with, and even literature, the publications are out there now, Aesthetics Journal, Aesthetics Medicine, finding all that out, because, being prepared for what you're going into is essential, not to distract you, not to deter you, but just to complete that picture for you.
Oh, absolutely. And what would be your advice to the practitioner who new to the aesthetic? What is the best way to attract patient, retain patient? So what insights you can share on that?
I think, nowadays the online presence is huge, and certainly social media plays a big part in that. Depending on the demographic that you're going to attract, for me, that naturally evolved into sort of probably age 35 to age 75 or 80 that I'm treating. I don't know how that demographic came about, but that's me, and that's what I enjoy doing. But certainly having an online presence, so things like Facebook, Instagram, will give you a shop window to show who you are, be genuine, and to build awareness of who you are. It may not transfer into bookable appointments. It probably will do with time, but at least it's a very affordable way to get yourself out there. Word of mouth is always going to be the most powerful way.
Yeah.
It's the most genuine way. You will get serious people who want to embark on treatments. So word of mouth is huge. Encouraging or sometimes incentivizing slightly, those that you treat, to spread the word. A website. Nothing, it doesn't have to be all fancy. A website is really important as well. Investing in that fairly early on. It's something that people can do themselves. There are so many things online for them to do themselves. Again, that is a major importance so that people can find you and you're not relying just on your existing patients. Advertising as paying advertising, I think that's quite costly early in the career. I don't think that I would personally wouldn't advise that. But I think those are, the really sort of simple ways and affordable, effective to start to grow, your presence, so that your brand, that's you, gets out there.
That's very, very good advice, and I think you're so right about being present and show yourself. And it may not necessarily transfer into the appointment, but it builds a trust. It's almost people want to know what kind of practitioner, what kind of person you are before they will decide that it's the right time for them to come. I think through my career I have seen and learned so much. I have some patient who has been following me on Instagram and know all about my career before they come to the clinic. And I have had patients who had consultation 7 years ago but didn't go with the treatment, but come back 7 years after their consultation. I think that is also lessons that we learn. And that is, I think, what is we can probably give new people as mentors, share this experience, reassure, and put them in the right direction as well. Not only with the treatments, but with experience and business model as well in some way.
I totally agree. Any time that I spend with a prospective patient is never a waste of time.
Never.
It's never a waste of time. It may not, my focus is not for it to transfer into profitability, into treatments. My mantra is to give that patient exactly the right advice at the right time in what they're seeking, and to redirect them if I can't help them. And in a marketplace that is so busy, so busy in aesthetics because we're unregulated. That's another topic in itself, which is a minefield. It literally is walking in a minefield. That is, patients like the connection with that human spirit.
Absolutely.
And with the person that you are. And that cannot be understated. So just being you, being genuine and letting that really shine through. We all have, exceptional talent, education, knowledge, research abilities behind us, yourself, amazing. Then the person that you are is so important to complete that picture. So important.
Absolutely. And Rosie, you mentioned that we're working in such a busy and sometimes feels saturated maybe industry. So do you think aesthetic have reached popularity, or there is still scope for growth?
I am so frustrated because I'm a lady of a certain age. I know that we can carry on forever. I know that we can, but at 63, I'm aware that my time is not short, but I want to work as long as I can because I love what I do. It's not going to work, is it? When you wake up in the morning, it's not going to work. We enjoy what we're doing.
Absolutely.
And aesthetics is here forever. It's always going to be here. The shape of aesthetics is changing, and I wish in some way that I was entering into aesthetics probably a couple of years ago. I'm proud to have been right at the beginning of it, but it is so exciting because it's moving within aesthetics into regenerative medicine. So the aesthetics will be here, but the shape of it will be different moving forwards, and it's an exciting time, for patients, but for practitioners as well, because the evolution of it is tremendous.
But I think also what is really admirable is that, some people who have been in aesthetic from the beginnings, they not necessarily like the change, and sometimes they resist the change, when I think it is important to go with the change, accept it, embrace, learn new things. And I always inspire how you evolve within your practice, bringing new treatments. Yes, definitely. So you think it will be growing? It
will still be growing. I think that there may be a shift in demands. There are certain treatments that we've always done. So if we mention line softening, that is always going to be there, always. But there is a shift towards, cellular health, the whole person. So positive aging from the inside
360 approach.
Outwards, yeah. Absolutely. And it seems so obvious now, doesn't it?
Yeah, absolutely.
Yet 5 years, maybe 10 years ago, that wasn't something that was ever thought about.
Interestingly, because I think I feel with aesthetic change now, I feel I'm going back to my childhood because I have been brought in a very different way from, for example, how we bring children in a modern world. I grew up in a farm with my grandfather, eating all locally grown fruits and vegetables, and preventative type of things was huge. You are second generation, or is your grandparents also were medics, Rosie?
I never knew my grandparents. They passed away before I was born. So no, the only sort of health professional was my mother.
And my grandfather was a doctor. I'm third generation of doctors.
Yeah.
So, and highlighting importance of cellular health, I was embedded with it as a child.
That's amazing.
Then when I grew up, I went my own way, not always 100% following their healthy choices, but I always will going back to them.
Yes.
And now sometimes I feel, is it new, or are we going back to basics where we came from? But it's incredible how the future is shaping, and how we're looking at the health and how we can heal ourselves from within as well.
Yeah, so I mean that transition is within you, isn't it? Because that's where you started, and that from a very early age. Whereas I think in the UK that generally isn't the case. So you're ahead.
Well,
what seems a very natural process.
I think it came back to me really when I have had my children, thinking about what they eat, how it impacts them, what impact it will help on their hormonal health when they reach it. So I think that is kind of all matters and important. So I think if you know this information, it's so vital to share it. But Rosie, what would be your advice to the patient who looking for making some changes, unhappy with their aging, appearance, skin, and trying to find this practitioner who will deliver for them? What they should be looking for? How to find the clinic, the person?
Do their research. Do their research. I think it is. If we're talking about, looking at regulation, we are one of very few countries worldwide where aesthetics is unregulated, and anybody can pick up a syringe and inject.
It's dangerous.
And that raises so many questions. What is it they're injecting? Where is it from? Because they can actually buy an equivalent of a toxin online from China. And, you know, it's an absolute, you know, befuddles me. It really does how this can carry on. So do the research. Don't shop on price. There's a reason that some prices will be incredibly cheap. And that is more likely, I'm not saying all the time, but that is more likely to be somebody who is unregulated, so they don't have a registered qualification with a governing body that will direct them, and they have strict ethical codes and practice standards to follow, because they may lose their registration should they breach those. And in that area, we're looking at registered doctors, nurses, dentists, and debatably anyone with that registered qualification. So that may be an operating department technician as well. Dental nurses have a registrable qualification, I believe, don't they, on the register?
They are on register with General Dental Council.
Yeah.
Also, me being a dentist, I would say I have a huge respect for dental nurses.
Yes.
And I'm not sure if they have the right background on injectables,
Sure.
but most definitely they have the right background, and if they want to assist their dentist with skin treatments, energy-based devices, completing appropriate training,
Yes,
I think that's
different.
probably would be
is.
a better pass.
Yes.
I think someone who has more intervention with patient on daily basis probably needs to lead the clinic.
Yes, I think you know, I am very much, you know, I am very much a supporter of doctors, dentists and nurses.
I'm the same.
Doing aesthetics and offering those treatments. Looking into, you know, from a patient's point of view, how long have they been doing aesthetics? Look at their reviews. You know, research them online. There is a way of checking, which we don't often talk about, that their registration is correct. So anyone can search the NMC, the GMC, or the Dental Council to check that practitioner's name, that they are registered, and that will verify their qualifications. So again, that's a big standard of safety there. Yeah, look at their reviews, have a consultation. Don't feel that you have to have treatment. If you feel pressurized at that moment in time to have treatment, walk away. Just walk away. There's no rush in deciding whether you take that next step to treatment. See how you feel within a couple of, you know, providers, whether that's somebody within a bespoke space, clinically at home, whether it's within a clinic, wherever they're providing these services. Just have a consultation with probably a couple of providers. Do you feel safe? Do you feel comfortable? Do you feel listened to? You know, is somebody listening to what you're saying, or are they trying to direct you to a specific treatment that isn't something that you particularly are interested in or talks to your needs? And, you know, look at the premises as well. You know, are they clean? Are they CQC registered? Which again is a big tick for standards and protocols that may be in place in some providers. And take your time to make that decision, and make the right decision within a suitable time frame. Don't rush, and then take that next step further.
I think that is very thorough and excellent recommendation. So I think if you're a patient, you definitely should take Rosie's words on board. And Rosie, working in the industry, I'm sure you have some treatments. So can you share what is your favorite treatment?
How do I pick one?
Few.
How do you? Thank you. Right. Okay. So to start, need two hands. Injectable treatments, or the full face approach, is always it's so fulfilling to assess somebody's sort of needs and maybe what they're wanting to achieve, and direct them in the most appropriate way. And when they embark on a treatment journey with injectables, that moment, and you know it, that moment when they sit up and they look in the mirror And I have this habit, Ola, of always turning away. Maybe that's a little bit of my confidence issue, but I don't want to see that moment when they look in the mirror. I turn away and I just hear this, and you just...
And then you feel you achieve.
You melt, don't you?
Yeah.
You melt. There is nothing like it. You know, delivering babies is amazing as a midwife, but you know, the impact, the psychological impact for that patient, and in every area of their life, you know how that is going to, you know, just help them. And it's not just what we see in the mirror, as you know, it goes far deeper than that. So injectables will always be my passion. However, we are now moving into regenerative medicine, and skin is undeniably an untouched area, really, until recently with devices or modalities that we talk about. So skin regeneration, improving skin health, whether it be pigmentation, whether it be acne, positive aging, collagen banking, is so exciting. And the impact of just having skin treatments is huge, because nobody knows what their skin can do until they step away from the high street.
Absolutely.
And then they embark on treatments within clinic. And again, that has equal psychological impact, you know, just for healthy skin without any of those medical issues with it. So the devices, I do love Neogen. I love plasma treatment to the skin, sort of low-grade ablation to the skin. I do like radiofrequency microneedling as well. Again, all of my treatments, they work well together because they address all those areas that unfortunately one treatment can't do.
Yeah, it's all about 360 approach, isn't
Absolutely.
it? Yeah.
Yeah.
And Rosie, is there anything that you wished you learned earlier in your career?
That's an interesting one. I wish that skin had been as big as it is now. I think skin is just going to increase and increase within the aesthetic field because of the regenerative model. I think for me personally, be softer on yourself. You know, look back at little things that you're doing and enjoy them. Don't rush. Take your time. Take your time to take that next step within aesthetics. Many go on trainings and are asking to become trainers, which takes time. You know that takes time. It's not just a level of skill. It's communication, you know, as well as the knowledge. But just take your time in consolidating on each training that you do. Don't rush it. And I think that would be very good advice. I think at the moment, practitioners are probably wanting to go a little too quickly. They're safe. They are safe. But they don't need to go as quickly to learn everything in that one, you know, in that a short few months. It's not possible. It's not possible to be proficient and outstand in all of those.
So that is a very good advice to those who are starting as well. So just be patient, master your skills, and then progress at your own pace.
Yes.
And Rosie, I think through our conversation, you answer this question, but I still would like to ask specifically, do you believe that correctly prescribed medical aesthetic treatments have an impact on patients that goes beyond the mirror?
I loved your phrase, beyond the mirror, because we know that in those consultations, you know, this is not vanity. This is not vanity, because we know from the emotive language that patients use and how it impacts them, you know, and we know from clinical studies that the link with mental health and well-being on what we see in the mirror, the impact of that is undeniable. So it goes far beyond the mirror, far beyond the mirror. The mirror is the tip of the iceberg, and it's what is actually sort of behind that mirror that is so important in making that mirror image to a pleasing level, not going too far, but also to help with well-being, help with confidence, self-esteem. A lot of the time we're dealing with a specific period in life, with perimenopause or postmenopause. We know medically the impact of that. We know psychologically the impact of that, sociologically and politically. So the mirror is just a tool. It's just a little shaft of light. And opening that door really lets all that light in. And that is the whole gambit of that health and well-being that's behind it that go together.
That is incredible, Rosie. Honestly, your answer is like music to my ears. Thank you so much. And the last question, can you please tell where patient or practitioner can find more about you, your clinic, if they want to connect?
Oh, thank you. My clinic's based in West Bridgford, Nottingham, just outside Nottingham, and it's called Prosthetics. I have a training subsidiary company as well, so Prosthetics Courses, like yourself, to train doctors, dentists and nurses. I'm part of the Allergan Medical Faculty, which is a worldwide pharmaceutical company, as you know, and the largest manufacturer of aesthetic, sort of fillers and toxins that we use. So contact can be made directly through my website, on Instagram. We do get messages on Instagram, of course. We don't fear that one. And just by emailing in from the website. I'm here to support anybody just to talk about embarking on aesthetics. I do overshare, as you know. But I'm here to support anybody and to direct them to the right areas if it's something that we can't help them with.
Thank you so much, Rosie. It has been a great pleasure. Thank you for your time.
It's lovely to spend time with you.